Hello everyone, welcome to my YouTube channel. I'm going to be discussing something with us today that I believe will be very helpful to us. So I'm trying to answer a question that that has been asked someone that went for American Society for Clinical Pathology exam. Remember that this question as well can be asked anywhere during your interview, maybe when you go for biomedical scientist interview, or as the case may be. But before I continue, my name is Dr. Emmanuel Obodo. I'm a biomedical scientist, and I'm also a lecturer in biomedical science here in the United Kingdom. So let's look at the question that has been asked, okay? This question has to do with a sickle cell screening. So the question goes this way: a sickle cell screening test is positive. What confirmatory test should be performed? A sickle cell screening test is positive. What confirmatory test should be performed? A, they gave solubility test. B, hemoglobin electrophoresis. C, direct cum test. And D, osmotic fragility test. So now let me give us background, then I'm sure the answer will just come up quickly. So what happened is that in a case where we are suspecting that possibility of maybe that a patient might be sickly, okay, there are a number of reasons why that can lead to that. Let me give us a little background. Let's say we've done a full blood count of a patient, and maybe means say hemoglobin, some of the rest indices, suggest something that could go along that line, okay. So and then we look at the blood film, and when we look at the blood film, maybe we've seen some sickling cells, as the case may be. So that can actually prompt, okay, for the investigation of the possibility that this person has got is sickle cell, okay. Now some cases as well, it could be during pregnancy, okay. So a woman may be pregnant and the normal screening, okay, and the person have come for the screening, and maybe perhaps depending on the result of the that we've got, we could decide to do a screening test, as the case may be, okay. So there are many condition to that, but that could lead to us doing screening trying to determine or investigate the possibility of sickle cell. Now, but what happened is that the way it is done is this: if we suspect sickle cell, if we think that someone is sickle cell, we first of all do screening tests, okay. So that screening test, we just tell us positive or negative, okay. It will say it is present or is not present. And the screening test has to do with what we call solubility test. So that solubility test is based on how transparent, if it is transparent after all the incubation and all of that. If the result come out to be transparent, you can still see through the medium of the testing. If you can still see through, that means there is absence of the sickle cell in that sample, okay. However, if you cannot see through, that means it is not transparent, it is turbid, okay. So that's the word. If it is turbid, that means you are not able to see through, that means it is positive. So when we do that screening test, the principle is based on turbidity. So if you can see through, that means it is negative. But if it is turbid, that means you are not able to see through the sample again after the incubation. That means there's a possibility that the person has got sickle cell, okay. So now, and that first phase is screening test, and that screening test is what we do is by solubility test. That means the ability of the sample to be soluble, to dissolve, as the case may be, in that very solvent that is being incubated on. However, if it does not dissolve and become turbid, that means the sickle cell is present. So solubility test is not the answer. Solubility test is not what we use for the confirmatory. It is actually what we use for the screening. That's why I have to explain that, okay. So once we suspect that a patient possibility of having sickle cell, okay, what we are going to do, we do what we call screening test, and we do that screening test by doing solubility testing, and the principle is based on turbidity. So if after the incubation and all of that, if the solvent or remain transparent, that means it is negative. But if it is turbid, that means it is not transparent, you can't see through it, there is a possibility that that is what positive. But we cannot, because of screening tests that we've done with solubility tests, say that this patient is positive of like the person. We can't use it to diagnose someone of sickle cell disease. Does that make sense? So because of that, we now need to do the confirmatory test. Does that make sense? Now, in that confirmatory test, that's where we can now do something like maybe high performance chromatography, that is HPLC, okay? High performance liquid chromatography, HPLC, okay? Now, that HPLC, you can also see it as something like they gave here, which is hemoglobin electrophoresis. So what happened is that, remember that on the red blood cells, you see there is hemoglobin, and there are different types of hemoglobin, okay, proteins. So you can see maybe, for example, hemoglobin A, hemoglobin S, hemoglobin F, hemoglobin C, and so on. Does that make sense? So what happened is that when we now expose the red cells, okay, onto this very hemoglobin electrophoresis, is going to cause a suppression of this very hemoglobin according to their proteins, okay, according to the constituent of the hemoglobin protein, and then it can give a certain result based on the suppression. So the suppression of the blood cells is going to be dependent on the type of hemoglobin present, okay, and once it separates in a way that is consistent, that it is hemoglobin S, that means sickle cell, then we can say that the person is hemoglobin S, okay, that means sickle cell. But if it's separate according to maybe hemoglobin C or F or A, then we diagnose otherwise, okay. But in this case, if we are going to confirm someone that is screening cell positive, we are going to do solubility test. Then if it is positive, we can now do that hemoglobin electrophoresis. And if actually the person is sickle cell positive, the suppression of the protein is going to be consistent as that of the sickle cell disease, okay. Now, that hemoglobin electrophoresis, like I've said, we can also be what we call high liquid performance chromatography, okay. So what that one does, that it doesn't do by banding, it's not separating based on bands, okay. So it's not based on band. So with hemoglobin electrophoresis is based on banding of the proteins, if you understand what I mean, okay. So the proteins separate according to different bands, but with HPLC, okay, is going to separate based on peak. Okay, so it's still the same principle. So depending on the peak of the type of the hemoglobin, it cannot separate accordingly. So we can also use high liquid chromatography to be able to high liquid performance chromatography to be able to confirm where the solubility testing is positive or where the screening test is positive. So the answer really here is hemoglobin electrophoresis. But don't forget, it could also be high performance liquid chromatography, okay. Now let me go through the other options that they give. So because the one that is likely to confuse someone could be A. Remember, solubility test is for the screening test, not for the confirmatory. So they've already done the screening test and it is positive. That means they've already done solubility test, okay. So what we can now use for the confirmation is hemoglobin electrophoresis. So B is the correct answer, which is hemoglobin electrophoresis. But like my custom is, I'm going to try to explain the other options. So they gave option C, which is direct cum test. So with a direct cum test, it is different from what you are trying to measure. So with a direct cum test, or what we can call direct antiglobulin test, so what that is doing is that it's trying to measure the presence of the antibody that could be present on the surface of the red blood cell. So when antibody bind, IgG antibody, or or maybe something like complement bind on the surface of the red blood cells, okay, so we can use direct cum test or direct antiglobulin test to be able to detect that. So with direct cum test, what is likely to show us is if there is something like hemolytic disease, okay, hemolytic disease of the fetus of the newborn, or maybe there's something like hemolytic anemia, as the case may be. So sometimes if the destruction of the red blood cells are due to the antibody binding on the surface of the red blood cell, we can use direct cum test or direct antiglobulin test to confirm that, okay. Now, having said that, the third one is saying the D option is saying osmotic fragility test. Now, this osmotic fragility test is a little bit close in terms of a direct cum test, but a little bit different. So with this fragility test, what we are trying to examine is how viable, how healthy the red blood cell is, the ability of the red blood cell to withstand hemolysis. Okay, so if there is, let's say, antibody is binding on the surface of the red blood cell, what is the ability of the that red blood cell to withstand that hemolysis? So that's that ability or the strength or the healthiness of the red cells that make it to withstand against hemolysis is what we call osmotic fragility test. Okay, so with osmotic fragility test, there's a possibility of hemolysis, there's a possibility of the red cell destruction, but if that red cell is very healthy, is likely to withstand, okay, against that to some extent. So the ability or the possibility of red cell withstanding that hemolysis is what we use that is what we use osmotic fragility test to measure. So let me go again now. The question is, a sickle cell screening test is positive. What confirmatory test should be performed? You already know the answer. A, solubility test, no. Okay. B, hemoglobin electrophoresis, that is the answer. C, direct cum test, that is not the answer. And D, osmotic fragility, that is not the answer. So the answer here is hemoglobin electrophoresis. But don't forget, it could also be HPLC, which is high performance liquid chromatography. I'd already explained that. All right, so do let me know what you think about the video. Put a comment and let me know what you think, and I hopefully you did enjoy the video. Please, can I ask you to subscribe, comment, like, and share with people that you think that this video would also benefit? And can I also ask for a favor as well? If you are already practicing, you already have experience, and you think that there's something that I missed, feel free to put it on the comment section. I'm sure that will help people that come across the video. But anyway, till I come back your way again, thank you so much, and I wish you all the best in your subsequent interviews or exam. Bye-bye.